So you clicked on this video because you wanted to know how to ace your medical school interviews, be it MMIs or panel interviews. Well, this is how. As with a lot of things in life that seem extremely difficult and hard to tackle, I believe in keeping it stupidly simple, or as I remember it, KISS. Keep it stupidly simple, and these 6 tips are going to make your life a whole lot easier. These couple minutes are going to be extremely valuable. So without wasting any more time, let's get into it. First of all, so important is to not memorize your answers. Never, ever memorize your answers. You know when you're in school or your lecturer in college just reads off the PowerPoint slides, completely loses the entire classroom, and you see a couple students asleep in the corner. That is what happens when you memorize your answers. You completely lose the person, because we're smart, humans are smart. We can tell straight away when someone's just memorized something or whether they're speaking from the heart. So when you're preparing for key questions, such as why medicine, whenever you're explaining, for example, your hobbies or your motivations, try and prepare these questions through bullet points only. Try and structure them just with bullet points. And then you can flesh out the answer and demonstrate your personality through your answers as you expand on them. But don't just memorize them. Write out a bullet point and then practice saying those bullet points. Obviously, every time you say it, it's going to be slightly different, but that's okay. That shows that your personality will shine through that way. So bullet points only. Be prepared to think on the spot, because imagine if all your answers were memorized word for word, how robotic that would come across and how badly that would come across. In everyday life, when we make connections and talk to our friends, we're speaking off the cuff and we're responding based on what they've said, and it allows us to let our personalities shine through, which is what they're looking for. They're looking for someone who's relatable, someone that's caring and kind. So remember to be prepared to think on the spot and welcome it, embrace it. Tip number 2, interviewers are normal people who want to see another normal person. And this one seems a bit weird at first, but really it comes down to, in a lot of situations in life, we get imposter syndrome. We feel like we don't deserve to be there, or, you know, why would they speak to us? Why would they interact with us? What do we bring to the table? And to deal with any situation like that, I always like to think we're all people. We're all just people at the end of the day. So remembering that the interviewers are normal people and they want to see a normal person, someone that is genuine, has integrity, is honest, kind, compassionate, and someone that would be a great doctor. A lot of the times, the interviewers, they might potentially go off on a tangent to the original list of questions they have, just because they want to get to know you a bit more, to see that you're just a normal person with hobbies, interests, friends, and someone that has the ability to be taught, because that's a key skill as well, being teachable. And how do you show them that you can be taught? By leaving your ego at the door. Yeah, removing all ego aside, just being humble, being someone that has a growth mindset, someone that the more mistakes they make, the more they'll grow as a person. So I think that's an important thing to remember. For example, if they ask you, what do you do in your free time? What are your hobbies? Instead of listing out all the achievements you think might impress them, instead tell them about what you've learned from those hobbies. Tell them how that relates to medicine and how these skills can be interchangeable between the two. Number 3, keep up with the news. This is quite more of a specific one, but also very important, because multiple questions could be linked around the news. There are certain stations which could just solely be talking about current affairs and medicine in the current state, the NHS currently. Some also talk about technological advancements. They could ask you about what's a new drug or medicine or technology that's come out recently that benefits the NHS or benefits the system as a whole. I think a really important thing also is understanding that the job isn't all sunshine and rainbows, that understanding the difficulties of the job, but also then highlighting how the job can be mentally rewarding. And at the end of the day, you want to help people and you want to reward people. So remember to balance it out too. Number 4 is practice, practice, practice. Practice with friends. It doesn't even need to be people in the medical field. Anyone that's done interviews before, and if you can, doctors or medical students. Because I think the most important thing about practicing isn't necessarily the content you say, but how you say it. Your mannerisms, your gestures, your facial expressions, your body language, how you come across, because it's such an underestimated part of how you come across. At the end of the day, first impressions count, and everyone judges people by the way they express their bodies. For example, stand up straight with your chest out, smile, make good eye contact. Remember to introduce yourself. In medical school, whenever we see a patient, we always introduce ourselves first before asking about them, because we need to make sure they feel comfortable and safe. So introduce yourself. Don't forget the basics, as these are some of the things that go out the window when we're nervous. So remember this going into the interviews, because it's easy to forget. Tip number 5 is always use evidence to back up your claims. What I mean by this is, for example, if you say you have good communication skills or you have good leadership skills, tell them why. Always explain why. And another important part of the process is work experience. Work experience is so important, because what better way is there to find out if medicine is for you than actually going into the hospital and seeing firsthand what happened. From your work experience, write down everything that you saw and you learned. For example, the communication skills needed, teamwork skills, leadership skills, and then relate that to your own life and evidence it. How in my life have I shown I can demonstrate those skills too? And lastly, but not least, don't let one bad station get you down. Remember, every new station is like a clean slate. 99% of people are going to have one bad station at least, especially when nerves kick in. Remember that whatever you thought was bad might not actually be bad, and what you thought might be good might not be good. Just remember to be yourself, be personable. If you think a station went bad because you didn't necessarily know all the knowledge or the right answer, remember to be a kind person with integrity. What's more important at the end of the day? Are you a good person? Are you a bad person? Alright guys, all that's left to say is go out and smash your interviews. I know it's interview season right now, so to everyone applying this year in year 13, smash out of the park, you got this. And if you want to know more about what being a medical student is really like, then check out some of my other videos. I'll put a link up here. I know these tips are going to bring you success. So good luck and see you soon.